All right, hello everybody. We are going to jump right into content because we are late. So Tiaan had a few patients held her up, which is awesome and so much fun. So we're going to jump into our super hot conversation today on specifically talking about bacteria and endometriosis because it's very, very common. We're seeing a lot of it through our patients. So without further ado, Tiaan, let's get through this. Let me make sure everything's working over here. Seems to be all right.
Cool.
All right, so let's break down endometriosis and what you're seeing with endometriosis, common symptoms, and then how it all relates to bacteria. And then we've got some examples. So just tell me when you want me to move to the next thing.
Yeah, cool. Okay, so we've been seeing lots of endometriosis patients, and I've been seeing endometriosis for quite a number of years. When I studied it, I was very much taught, and we were all very much taught that endometriosis is, in fact, a hormone condition. It very much relates to estrogen, which is true in a way. And this is something that I just want to start with, because a lot of patients come to us, a lot of women come to us with endometriosis, and they go to see either a gynecologist or an endocrinologist who both focus on hormones, which is fantastic because estrogen levels are so dramatically affected with endometriosis. So I'll quickly explain how estrogen is affected with endometriosis, but then I want to explain to you how it's not actually an estrogen or a hormone problem. Hormones are affected, but it actually stems from the gut microbiome and the immune system. So what happens is, as females, we have a lot of estrogen in our body, and always with endometriosis, there is an estrogen dominance picture that goes on with that. So when we get our period, our estrogen levels surge, they go up really high and then they go down, and that endometrial lining that happens inside our uterus, that sheds, and we have a bleed. With endometriosis, that endometrial tissue goes outside of the uterus, and when that estrogen falls and we have the bleed, that endometrial tissue is stuck outside of the uterus and in other parts of the body. So then we need to ask the question, okay, well, why is this happening? It's not the estrogen, it's not the hormone's fault. Why is this happening? So that brings us to what's going on with the immune system. It's our immune system's responsibility to travel around the body, see where there's foreign particles, foreign objects, and clear those out of the body. So it's obviously not recognizing that there is endometrial tissue outside of the uterus, and is obviously not clearing those out. And then when we look at the symptoms, let's have a look at symptoms now. Where's our symptoms page? So the most common symptoms we've got pain, and it's excruciating pain. Like, I'm talking, like, women are telling me that it feels like they're pushing a baby out. Like, it's really bad pain. Periods are really heavy, clotting, suspected IBS, but I've never seen an endometriosis patient who does not have gut issues. Bloating, mood changes, pain during sex, vaginal bacteria. So then, just looking at these symptoms, these are not hormone symptoms. So why is this classed as a hormone condition? These are, okay, heavy periods, okay, clotting, but IBS, bloating, that's a digestive symptom. Mood changes, it's not necessarily hormone. So we need to really, really focus on gut health, gut microbiome, and the immune response when it comes to endometriosis treatment.
Awesome. So let's go. We brought a really cool case study, which I want to get into now, because I think that that's where things are really quite fascinating for a lot of our patients, because it's a thing that we do differently than, let's just say, going to the doctor, right? So they could go to the doctor and they could, have a similar experience, but we've actually brought the stool test example. So I really want you to go through it, because most people haven't ever had anybody show them a test on what poo looks like if they have endometriosis. So I really want to get into it. So we brought Lauren's whole case. So could you briefly just talk a little bit about how Lauren presented when she came to you, and then we'll go straight to the stool sample.
Yeah, okay. So Lauren had the main things that were affecting the quality of her life was obviously the endometriosis. She was spending about 2 weeks per month in agonizing pain. She was the one who said to me, she's got kids already. It felt like she was in child labor leading up to her menstrual cycle. She also had a lot of mental health issues, and she was on a lot of medications for her mental health, which wasn't working. She also had extreme systemic pain in her joints. So her whole body was constantly in pain, and IBS, so gut issues. She was very constipated and suddenly very bad diarrhea, and she was waking up every morning with a lot of nausea. So we went on, she was already diagnosed with endometriosis, so we went on and we did some further tests. So we did a test to see if there was a breath test to see if there was any small intestinal bacteria overgrowth, which there was. We did a gut microbiome test, and we did a reproductive hormone salivary test. So she was very, very high in estrogen. She was extremely estrogen dominant. Like I said, estrogen is a characteristic of SIBO. Of endometriosis, and we did a gut test that looked at all of her beneficial bacteria, all of the opportunistic bacteria, inflammation in the gut, worms, parasites, and things like that. And her results were really interesting. And I'm so I don't think I've said this. I've been working with her, and with I think we had a conversation about her a month ago, or maybe 2 months ago, and her results have progressed even more, which is awesome. So yeah, let's take a look at her results, because I want to discuss what's going on with her gut health. And this is someone who was on so many antidepressants, medications for her mental health. Now, all of these words look quite funny. They're very long, interesting words. We've got up the top here, we've got opportunistic bacteria. Now, with our microbiome, I'll explain it in a really simple way so that this makes a little bit of sense. We actually want approximately 80% beneficial bacteria, and we've got beneficial and bad. It's not bad, it's bad when it overgrows. So we want a small amount of opportunistic bacteria. This opportunistic bacteria is beneficial. It's when that opportunistic bacteria grows, moves to places where we don't want it, that it can become a major issue. Now, so this opportunistic bacteria, there is so much overgrown here, and bacteria contains chemicals, and bacteria produces endotoxins, and they produce chemicals. Good bacteria produces good chemicals. Good bacteria produces chemicals that are necessary for blood sugar metabolism, hormone health, and our mental health. So they produce chemicals that help with things like dopamine, melatonin, our sleep hormone, serotonin, our happy hormone, and all of our happy chemicals. Overgrowth of opportunistic bacteria will produce chemicals that are not good for our mental health, and endotoxins. And these chemicals will cause things like depression, irritability, instability in our mood, pain, inflammation throughout the body. I've read a few research papers saying that one of the main symptoms of endometriosis is mood changes, irritability, depression. Some people get quite severe, and that has been linked down to this overgrowth of the opportunistic bacteria and the chemicals that they produce, which is super interesting. Yeah, so that's in a nutshell what's going on there. We've got a few autoimmune triggers. The Streptococcus there is, that's necessary for immune function, things like that. So this is obviously telling us here that there's an immune system malfunction going on, which is causing inflammation in the microbes and the bacteria in our gut.
Can I ask a really random question? A lot of the patients that, one of the key stems that the research is showing is that a lot of patients have had glandular fever, or they've had their tonsils taken out, or their adenoids removed, or they had grommets put in when they were younger, right? Or glandular fever or Epstein-Barr virus, in that sort of 16 to 24-year-old bracket. And I see here that there's the Streptococcus. Does that have something to do with that? Just out of curiosity?
Yeah, it does. And yeah, The other thing with Streptococcus is symptoms of elevated Streptococcus are like what you said, like throat infections, ear infections, basically ear, nose, throat infections, which can be associated with tonsillitis, grommets, things like that. But when there's dysbiosis is a fancy word for too much opportunistic bacteria, not enough good bacteria, your body can produce antibodies against Streptococcus. And those antibodies can go up to the brain and they actually can cross the blood-brain barrier, which affects our immune system, it affects our mental health, it affects our skin health. A lot of people with full-on, not this patient, this is not high enough, but a lot of people with quite severe schizophrenia, bipolar, even autism, have an autoimmune response to the Streptococcus, which is across the blood-brain barrier. So that's a really interesting.
Yeah, that's why I'm asking. Like, so of these bacteria, what are the bacteria like that you can see right off the bat that would have caused, some of the symptoms? Like, can you in 30 seconds, we'll go to the next example because there's a couple pages here. But like that just, I looked at that and thought, oh, that's interesting. This one's at 9.54 and that's the highest number on the page. Yeah. Does that point to any specific, correlation as a bacteria to symptom?
Yeah, that's an inflammatory. So the Pseudomonas, and the Bacillus, the first one, they are inflammation. And we can look at inflammation on the other slide. I think it's on the other slide. They are very strong inflammatory. So, and symptoms of those ones are diarrhea. And interesting, this patient had really bad diarrhea.
Wow.
Yeah.
Am I on the right next page for the inflammation ones? Okay.
Yeah.
All right. So talk about that just briefly. You got 30 seconds. Talk a little bit about Pylori, because this is something I know you see a lot of.
Yeah, so 50% of the world's population have H. pylori. Hers is quite elevated. Symptoms of Helicobacter pylori are usually reflux, or if not reflux, excess burping, bloating, and gas. So Helicobacter is higher up in the digestive system. It can be tested by a stool test or a saliva test. And this is, this really, in really super duper simple terms, tells me that her digestive enzymes are too low. So we actually want really, really, really high acid in our stomach, because that is the first line of defense. Everything is starting, even though Helicobacter was actually like one of the last on the page, everything is starting. This is telling me that everything starts from the top. That's why there's problems in the lower bowel, because obviously digestive enzymes are not high enough. Her stomach is not acidic enough. And so therefore, and that's the first line of defense, that's going to kill all of the opportunistic bacteria and all the invading particles that try to enter.
And here's another really high one, this Clostridia right here, which says it's a normal bacteria flora, but it's quite high. So what are some of the symptoms that have to do with that Clostridia class that's also quite high and quite elevated?
Yeah, Clostridia is associated with the immune system.
Wow, so much immune system stuff coming up. But she's presenting with endometriosis and IBS.
Yeah, I was going to say as well, Clostridia is all, a lot of, like, I had to look all of these up individually because I was really, really surprised. A lot of these are associated with diarrhea, but also we tested small intestinal bacteria overgrowth, or SIBO, in a separate test, which was positive, so she's got it. But a lot of these are associated with small intestinal bacteria overgrowth. So remember I said dysbiosis, like these bacteria become a problem when they move to places where you don't want it, including in the small intestine, which could cause SIBO. So these ones are associated with those ones. Akkermansia, that one is specifically associated with metabolic conditions like diabetes, insulin resistance. She doesn't have that though, but she does crave sugar. She eats a lot of carbohydrate and sugar. She craves it. She doesn't have diabetes, but it is associated with diabetes, blood sugar stuff. And then going
down about this last one, and then we'll keep moving because I know people are tight on time and we're running late. This firmicutes.
The firmicutes and the so those two are, so in your intestines you've got little villi and they line your intestines. They're microscopic hairs. You can't see them under the naked eye, and that is telling us that there is so much inflammation in her digestive tract. That's really, like, they are extremely high. I spoke to one of my mentors, or I guess the lab, and there's a man at the lab who's amazing at reading these, and I gave him a quick call. I often do, and they were at the lab quite shocked at how high these results were. There is an intense amount of inflammation, but also intestinal damage going on with this patient.
Wow. And just to recap, let's look at these symptoms, right? Because what I'm hearing you say right now is that Lauren came in feeling, her mood was crazy bad, like PMDD type of like extreme depression, sadness symptoms, which a lot of patients with endometriosis have, or they get put onto birth control and they get really extreme, symptoms. She was in a lot of pain. She was in pain even when she wasn't on her period. So half the month she was in pain. Did she have any dramas with weight, or was she okay? Because I'm just curious with that insulin bacteria.
No, I don't have dramas with her weight. I personally thought her weight was fine. She was happy to lose a little bit of weight.
Okay.
No,
right.
According to the BMI, she was fine.
All right. So basically what you did with Lauren was you did the gastrointestinal test, you did the SIBO test, and this is where you found a lot of her, symptoms coming through. So just out of curiosity, what would be the first step for a patient with endometriosis? Like considering that, and I'm just flicking through the slides right now, considering that most endometriosis patients have never even heard anything about the bacteria, why do they need to even look at their bacteria? And how did you do this treatment? So as we look at her results and things.
Yeah, so endometriosis is a gut and a hormone issue, a gut and an immune system issue. The immune system is predominantly in the gut microbiome. So with Lauren, we did some very, very specific dietary interventions. So we want to starve that opportunistic bacteria while helping with the growth of the good bacteria. We first went in and we did a specific probiotic called Saccharomyces boulardii. So that probiotic prevents the proliferation of the opportunistic bacteria but supports the growth of the good bacteria. And then we also did some specific things that she has a lot of leaky gut, really bad leaky gut, which is where the cells in the gut become separated and larger food particles can get through, which another topic, but that's also associated with the mood changes. So we went in, we did some gut healing, a lot of gut healing, and we will continue to do gut healing throughout the whole treatment. And then we moved on to the next phase. So the next phase was specifically targeting at antimicrobials to reduce the overgrowth of the opportunistic bacteria. We were doing a little bit of that before, but we went in with more specific antimicrobials. We have to be very, very careful with antimicrobials. Lots of patients come to us, they Google and they read online that antimicrobials are awesome, they buy antimicrobials online, but if there is inflammation in the gut going on, you cannot take antimicrobials. Antimicrobials also kill bad bacteria. And like I said before, bad bacteria produces endotoxins and chemicals. So we don't want to go killing that bad bacteria until we've got reducing inflammation and we're healing the gut and we're supporting the growth and supporting the good bacteria, because that we're not going to feel well if that's what we do. So we started with the antimicrobials a couple of months into her treatment. And we also did some anti-inflammatories, and we went in with symptomatic support, so reducing the symptoms because she had a lot of joint pain and muscle pain. So we did a lot of symptomatic herbs and things to help drive down these inflammatory pathways while coincidingly supporting with those phases of healing the gut.
Yeah. Now, a couple of things that are really interesting. So today I spoke to a woman, for instance, who she started a treatment and she didn't finish it. And a lot of her symptoms came back. She had started it with a doctor who, unfortunately, this seems to be happening a lot, that because of COVID, a lot of doctors left the country that were actually helping patients. Yeah. So we're starting to hear a lot of people who during COVID, maybe they're still waiting for their surgery, right? Or they don't have their doctor anymore. And or they started a bacterial regimen, and they are all talking about shedding, like scaling, and like the bacteria is coming out, whether it's through the hair or through the skin. Do you see that a lot? I mean, that's fascinating. I've never heard of that before.
It's really interesting. What did they have? Do you know? Did they have like Morgellons or something?
She just was doing. This particular patient just has like a genetic digestive issues, very full of diarrhea. Period issues, and now at that special perimenopausal time where she's starting to get intense PMS systems, but she's on both progesterone and estrogen. She's taking both of them, bioidentical, but she's having inflammatory gut issues and PMS symptoms, even though she's taking the medication.
Yeah, right. How interesting. Going through a gut protocol, it can be really full on, and people have reported some very interesting things. Some people even get things like pimples and boils. That's just their body's way of elimination. I hope I don't regret saying this, but some people might have worms or parasites and they see them come out.
Yeah, and like
So
I mean, we've seen all kinds of stuff. Like one, they'll have vaginal extreme, like a breakout during it. Like lately I've been looking at patient details because I've been doing the research, and I'm like, whoa, the stuff that people said. But this lady today was really quite fascinating. Okay, so in terms of like how we actually do this, I know you kind of explained it, but what is the first step? So how do you actually figure out whether or not we can help someone if they have endometriosis?
Yeah, so the first step, we will conduct a very thorough health assessment. We might do some symptomatic support to help with those initial symptoms. And if further testing needs to happen, or if that patient hasn't already had further testing, so we don't really know what we're working with, we will and we can refer for tests to get some deeper answers. Then we would get those test results back, and then we would draw up a very comprehensive treatment plan on those test results. The treatment plan potentially can go in phases, so we potentially might do a phase 1, phase 2, phase 3 to really heal and seal the gut, balance the good bacteria, potentially eradicate opportunistic bacteria if that's what's needed. And then sometimes sometimes patients do get really good results at the end of that, or sorry, they always do get very good results at the end of that, but then we need to do some maintenance, because it's very common for bacteria and things to come back. So we need to make sure that we do put together a very good maintenance program ongoing. So generally speaking, patients do experience symptomatic results quite quickly, but to really heal what's going on with endometriosis, it can take about 6 months. But symptomatically, we can get results within the first 1 or 2 menstrual cycles.
And Tiaan, why aren't the doctors testing gut microbiome for endometriosis?
Well, they don't know how to. I mean, they haven't studied. They don't understand. And I'm not saying each doctor individually. I just mean the medical system as a whole. They don't specifically understand the role of the gut and the immune system in endometriosis. The mainstream medical intervention for endometriosis is either a laparoscopy or surgery, the pill, or painkillers, or all 3.
Wow. And so in terms of actual like figuring it out, why can it be a bit dangerous to try and do it on your own? You know, because we've given a lot of information on bacteria and things, so people can go and Google it, they can go and look it up. But what is the what is the danger in one kind of trying to do their own gut detox treatment?
It's very comprehensive. There's a lot of very, very specific dietary things we need to do. The other thing, like I said before, is you can't just take antimicrobial herbs. They should not be sold willy-nilly from health food stores and pharmacies, and they are. It's quite can be quite detrimental to take antimicrobials just off the bat without knowing what you're doing. The other thing as well is, if you just go and do it by yourself, you don't really know what you're working with. So if you go and do it by yourself, you don't know what bacteria you're working with. You don't really
know what kind of bacteria is overgrown. So we had a question come through. What about berberine and NAC? So obviously we're not going to give out like specific advice on what to take or diet, like supplements or probiotics or any of the things, because everybody with endometriosis is that. I mean, we showed Lauren's example of her bacteria, but like if we were to pull up every bacterial stool analysis, there would be different bacteria on each and every single one in terms of what's inflamed and what's not, because endometriosis is quite diverse in terms of what type of bacteria. There's common ones, but they can change from person to person. So she's asking about berberine and NAC. So do you have any specific feedback for her on those?
I really, really like berberine and NAC. I'd be careful about, I'm not too sure about NAC, but I'd be careful about taking an over-the-counter berberine in terms of the pureness of it. And again, don't take antimicrobials unless you know what you're doing with it.
Okay.
NAC is a very all-rounder one that's quite safe to take. It's one of those supplements that's very safe under most circumstances.
Yeah, awesome. All right, well, everybody, I put the link below on how to connect with us. Tiaan's actually made herself available to do these free introductory consultations. So make sure you scoop one up now. If you have questions, jot them down, bring them to the actual calls. And it's really amazing when we're able to ascertain what's happening, whether it's, or Tiaan's able to ascertain whether it's hormonal or if it's driven by bacteria, and it's quite fascinating. So Tiaan, thank you so much for coming today. I really appreciate it.
Thank you.
And thanks everybody for joining us and asking questions. And we like to do more of this. So nothing better than getting live questions. So thanks again. Awesome. And we'll see you all very soon. Take care. Bye.
Thank you. Bye.